You're listening to the Casual Swinger Podcast. As your hosts, we need to warn you that the material you're about to hear may be sexual or explicit in nature. This podcast is intended for an adult audience. Now, we don't expect you to act like adults. What's the fun in that?
We're a married couple living in Florida with over 13 years of experience in the lifestyle, and we take almost nothing seriously. Casual Swinger is a variety show, meaning we'll cover everything from music to events, travel, and even the occasional hilarious screw-up. Our show is about entertainment. We're not licensed professionals.
At anything.
And our stories, commentary, and guidance should not be confused with the opinions of a licensed professional.
Now that you know, let's take those pants off and get comfy.
Hey everybody, welcome back to another episode of Casual Swinger. My name is Mickey.
And I'm Mallory.
You're a sexy Mallory.
Thank you. You made me feel sexy all weekend long.
Yeah, you were sexy this morning too. I got laid.
Yeah, and you took some dirty pictures.
I did, and they're dirty as shit.
I love it when you do that, by the way.
I like doing it too. You know, some of our friends on Twitter were like, "Hey, show us too."
We posted a PG one, didn't we?
Yeah.
Okay, there we go.
I mean, we're not really the dirty picture on Twitter type. I mean, every once in a while we'll throw something out.
Yeah, once in a blue moon. Mm-hmm.
Yeah. So this episode's been a long time coming, folks. This episode is called the Sick Dick Docs.
What are those?
Well, ironically enough, there are a couple of doctors we came across who specialize in helping people get the most out of their sexual health. So not erectile, not necessarily female body parts, a little bit of both. But the idea is really to just get people's sex life in line with where their mind is, right? Because as you get older, your brain and your body aren't necessarily on the same page. So we got lucky and we met these folks and they wanted to be on the show. And so we had Dr. Nicole Eisenbrown and Dr. Lane Phillips on the show with us this week.
Yeah, that was such a wonderful conversation. And then obviously we'll get into more information on exactly what happened with the procedure part. But I really enjoyed talking to him. It was almost like a 1-2 punch as far as like your chemical makeup and some, underlying factors. And then talking about function, not dysfunction, like improving function.
That's the reason I really wanted to do this episode, right? I mean, yes, just so you guys know, at the end of this episode, I absolutely went through some of these treatments myself so I could see what they were like, and we recorded it for posterity. So
yes, yeah.
Because I'm stupid.
Yeah, nothing like the ass waxing.
No,
right?
Ass waxing was way worse. But this is definitely interesting, and I did want to go through it for you guys and kind of see what was up with it. But the thing that I came away from it with that really stood out to me is how much I don't like the term erectile dysfunction. I think it's fucking emasculating.
Well, and if you look at the root word in dys, D-Y-S, or D-I-S, it means like bad or ill, or it's obviously very negative. And it's a Latin word and it's used in medical terminology, but when you hear it, you automatically trigger to feel maybe inferior or
I think
negative.
Men's sexual health and their virility, they really kind of go hand in hand. Like your status as a man is directly tied to your virility. And if for some reason, you are having trouble from an erectile perspective, or you are having trouble with a sex drive perspective or a sensitivity perspective, or just anything with your dick or your sex drive, you feel like you're shorting your lovers or not interested in them at all, worst case.
Yeah, and I don't think that's any different for women, like that peri and postmenopausal phase, especially because there's a lot of things that change.
Yeah, I think you're probably right. So all this said, folks, we were like, hey, we need to make an episode out of this, and we need to find some folks who can help us have this conversation because I don't think that everybody that's out there, first of all, I mean, we did this episode a year ago on swinger insurance, and it was all about, phony bonies, my cock's a flopping, and all these names for erectile dysfunction drugs, and I still didn't like it then.
Well, and there's not that there's anything wrong with those drugs, right? It's
swinger insurance.
Sure, but they treat a symptom, and what we talk about today is treating the underlying conditions that create the symptoms.
Yeah. And, there was one that actually really stood out to me, and I'm not sure if we actually catch it in the interview with the doctors, but the one that jumped out at me is that the earliest sign of heart disease is erectile problems.
Yeah.
And I'm like, whoa,
absolutely.
No shit, that's crazy. So some of the stuff that we went through in here and some things we talk about, There's things like Gainswave, which is a shock treatment. It's a lot like lithotripsy.
Yeah, and that's sonic vibrations, right?
Yeah,
that
it's
help.
getting shocked in the balls, and I did that for you guys here on Casual Swinger.
Yeah, that was actually fascinating. If anyone listening that's not old enough to know who Marvin the Martian is, sorry, it's the best comparative I have. Do you remember his laser gun?
Oh yeah,
that's what it looked like that she was using.
I saw
there.
it right before she's at me in the nuts.
Yeah, it was fascinating.
Yeah, it really was. But apparently that was designed to break up the plaque on the arteries in your sexual regions, your genital regions, sexual regions. Genitals aren't all sexual unless you're a pervert like me. But when we talked about what this was, the idea was to break up any plaque that you have and improve your blood flow in that area. Improve blood flow, improve erections, all that kind of stuff. So. Gainswave kind of goes hand in hand with this other thing that we talk about with the doctors, which is something called the P shot and the O shot.
That one was actually a little more invasive than I thought it would be. Even
Who
after
were you telling?
But you'd had a conversation a few times prior. I got the information secondhand from you, and then we met that day. And then when it actually started happening, I was a little taken aback. I looked at you and I wanted to be like, "Are you sure you want to proceed?" Because she took
55-gallon drum of my blood.
Close, 60 cc's.
It's same thing.
It was a lot. It was a lot. And then she spun that down in a centrifuge, and then she took the plasma, like the platelet stuff, and that's used therapeutically to help that area. And it was injected like
into my dick,
way into your dick, not just like surface, like trimix, like into your penis.
The dick. Oh yeah, I was there.
6 different places.
Yeah, and so one of the interesting things about this that you guys are going to hear, and we didn't really talk about it because I didn't want to freak the doctor out, but they do this thing called a penile block, which is they put this long-ass needle into your upper dick area, and it's supposed to numb everything. It didn't get all the way to the end of my dick.
Yeah, when she hit the tip of your dick and she went in on the left and the right side, right, because you don't want to hit the urethra. I don't get nauseous. Like, procedures like that don't upset me. And sometimes with you, I can waver at times because you're my person. But when I saw your reaction, I got a little weak-kneed, personally.
Yeah, but I got to tell you, Dr. Eisenbrown was great about it. She's got such a good bedside manner, and she's so effective, and she's so articulate at telling you what she's doing that even like when my toes curled and she's like, "Oh, you're in pain. We need to fix this." I'm like, "Nah, actually, just go ahead and go on with it." And that was my choice, not hers. Like anytime I was even remotely in a state of discomfort, she was like, "Stop, let's take care of the discomfort."
Yeah.
And only because, frankly, it's funny is why I let myself be in discomfort.
But whatever. Actually, I'm looking forward to seeing what your experience then versus a month and 3 months from now is like. If you can attribute any gain in sensitivity or anything like that down the road after having these things done, because you're still getting the Gainswave treatment. Yeah,
well, I'm going through the whole thing as if I had a full suite of the issues that they treat in Amore Medical, which is the name of Dr. Eisenbrown's clinic. But just the whole idea of going in and having the treatments was great for Casual Swinger. But for me, one thing that could come out of it, which was exciting for me, is I'm not very sensitive.
Right, we've talked about that
before.
We've
talked about that before on the show. Blowjobs are kind of a lost cause for me. I like them, but...
Yeah, and you've always been that way. It's not like it's something that was progressively deteriorating as you get older. It's been since you were little.
Well, which is why I'm so high on Unique condoms, because it's the first condom I've ever actually been able to feel anything. Yeah. Because I'm not a very sensitive guy down there, so being able to feel something through a condom is a fucking revolution for me.
Right.
But at the same time, this treatment is supposed to help grow new blood vessels and make me a little bit more sensitive. So I was actually excited to go through this personally, and not just, for a gag for the show or for education for you guys. But I think it was all of those things, which is what I love about Casual Swinger. Well, all the things. It was a gag, but it was also educational, and we're able to promote this amazing medical office, Amore Medical, that is offering this as a service here in Central Florida.
It is. It's actually kind of amazing, the suite of things she can do, and not just for guys, but for girls too.
Yes.
Because that same technique, that we talked about, like the pulling the blood and spinning it down and using that, women can use that in their clitoral region as well if they're having issues or they're desensitized or...
Actually, the biggest issue that it treats is incontinence after childbirth.
Yeah, you were reading my mind. Yep.
So that's like a really big deal for ladies, but it also happens to increase sensitivity and sexual satisfaction.
Yeah.
Because it creates new blood flow around your clitoris, which happens to be next door to your urethra, as it turns out.
Well, kind of, sort of. I think the way she described it, and I'd have to go back and listen to the tape again, I think there's 3 different areas where, as a woman, you get a shot. You have the clitoral area because the nerve bundles are a little higher, but I think the shot's actually in the clitoris. Then between the clitoris and the urethra, or the urethra and the vagina, and then near the G-spot, vaginally?
I believe that is what she said, but we're going to find out here in a little bit because we actually did talk about it here on the show. And I was really excited to do this. I'm excited for you guys to hear this.
Me too.
The Sick Dick Docs is part 1 of a 2-part series. We're going to have Dr. Lane Phillips back by himself to talk about hormone therapy and talk about getting right with your hormones and your vitamins and all the ways that can affect your sexual health.
I'm under 40, and I'm just going to go ahead and put this out there. I can't wait to dig a little deeper, and I know other shows have been done on that, but just my first round of treatment and working with him personally, I can't even tell you how much better I'm starting to feel.
Yeah, I think I'm in the same boat. Actually, obviously I started with the therapies with him, and we're going to get into that in the next episode that we do with Dr. Phillips. And it may not be the very next episode of Casual Swinger. It'll probably, be in the next couple of episodes though.
Yeah, no, it'll be a great conversation. I'm excited.
Yeah, very much so. So coming up here, we're going to talk with the Sick Dick Docs. Before we get into that though, we got to talk about the last episode we did.
Yeah, I want to thank everyone who sent their love and support. It was a little deep for me to go into my psyche and put it out there for, public knowledge.
It was a very different episode for us.
But I'm actually really excited to hear I'm not the only one that has that fantasy or would be interested in it.
Oh my God, no. We got so many messages from you guys.
Yeah.
Like, oh, this is so cool. We want to try it. We're into it. I didn't know how many adventurous couples are out there that aren't even necessarily hot wife couples or anything like that, where they're just like, no, this would be so cool, or they want to make their own porn, or it was just really neat to see everybody react.
It was, and we're legitimately trying to make this happen this year, and maybe I undervalued it. That's another bit of feedback I got was it's going to cost a lot more money than what you think it is. Yeah, and I hope not. But we'll see.
Yeah, we got a lot of really good feedback on it, though, and we love that. And I think a lot of you out there maybe that had kind of given Casual Toys a try at some point in the last year or two. Well, it's a year and a few, I think like 3 or 4 months we've been open. But somebody had come in and had a look and was like, okay, it's a little toy store, and things have changed. So a lot of you came back to Casual Toys, and a lot of you ordered from us at Casual Toys. Holy crap, it was awesome.
Yeah, no, it was a really great year.
Yeah, it was really awesome.
Yeah.
And we've had a really cool month with people buying our bundles for the unique condoms.
That's right. You did a buy 4 get a prize free, right?
Yeah, the Casual Toys Micro.
Yeah.
That's MICROH exclamation point. That's
You do love your branding.
I do love my branding, but I love that. I mean, I always tell people that's the nicest vibrator Chinese kids can make, but it's Mallory's looking at me like, you insensitive douchebag.
Oh, yeah, hardcore.
That's what I'm getting right now. But it is a great little vibrator, and we do give it away if you buy 4 packs of unique condoms. And it just auto-populates. I really love that. But it's, everything's going pretty good as far as the store is concerned. Got all kinds of cool stuff in there, from Liberator and now Elegant Moments and Daisy Corsets.
Yeah, we added more Elegant Moments to the store recently. Last time we talked, it was Daisy Corsets, and
Well, our girl Allie bought one of our swimsuits, one of the new Daisy swimsuits.
Yeah, I haven't tried those yet.
Yeah, well, she loves it. Like, she messaged me. She's
heard.
like, the stitching is amazing, the quality is amazing, and I picked it out for her, ironically enough. So.
Ooh, lucky dog.
Yeah, hey, sometimes my job doesn't suck.
I was gonna say.
No, it's not bad at all. But hey, we're going to jump into this episode with the Sick Dick Docs. Before we do that, Mallory, you want to tell everybody how they can find us?
You betcha. We are Casual Swinger everywhere. That's casualswinger.com. If you have a question, reach out to us at podcast@casualswinger.com. If you love us, feel free to drop us an iTunes review. We are also on Twitter, Facebook, YouTube, and Instagram. And you can find us on the dating sites Double Date Nation, SDCSLS, Cassidy, and Quiver.
And that'll do it. We're going to be back in just a hot second with Dr. Nicole Eisenbrown and Dr. Lane Phillips. These are the Sick Dick Docs, and we're going to talk to you all about sexual health. It's going to be a good one, folks. Don't go anywhere. You've been listening to Casual Swinger. Hey, welcome back to Casual Swinger. My name's Mickey.
And I'm Mallory.
We have a room full of special guests for you guys today. You know, we talked about it in the lead-in, but this episode is called The Sick Dick Docs, and we have a couple of esteemed MDs here with you, Dr. Lane Phillips and Dr. Nicole Eisenbrown. Ladies and gentlemen, sorry. How are we doing today?
We're doing great. Thanks for asking.
Outstanding.
Awesome. We're so excited to have you
Very
guys
excited.
here and have this conversation with us about normalizing relationships with your doctors and talking about your own personal wellness and your own health. And I think a lot of us don't do that for shame reasons and personal reasons, that we feel like we need to just tell the doctor what we think they need to know. And I think that's a huge fucking mistake. So we're going to talk about this on the show today, and we're going to get into different forms of erectile dysfunction. But more importantly, and what we really want to get away from, like we talked about in the lead-in, is improving erectile function. Not erectile dysfunction, because erectile dysfunction, we've all been, Mike Ditka on the TV telling us that his dick doesn't work. All these names for, all the different, types of Viagra, my cock's a flopping, my dick's a failing, Blue Diamond Phillips, all these other names. It just makes people think my dick doesn't work.
Right.
And no guy wants to believe his dick doesn't work. So let's get started. Let's get started by letting our listeners know you a little better. Dr. Eisenbrown, tell us about yourself. What's your area or your area of specialty? And where did you go to school? How long you've been practicing? And how did you get into dicks?
I love the last one.
That's a really, really good question, because I guess that all the time. In fact, most people, when they ask me what I do and I say urologist, they said, oh, neurology. And I'm like, no, urology. And then they stop and there's a big blank stare, because they're like, how on earth did you get into that? But the truth is, I had my left kidney surgically removed when I was 20.
Oh, wow.
So when I went to medical school, I had a natural interest in urology because it was personal to me. So I migrated into urology, which from my standpoint was kidneys, ureters, bladder. And then I find out it also includes all the male sexual organs and function and dysfunction. And when I was a resident, actually, ironically, my favorite problem to treat was erectile dysfunction, because I loved the surgery of doing a penile prosthesis. I know it's crazy, but
No, that's awesome.
I trained with one of the premier guys in the country, and he can do one in 15 minutes, and he's not even rushing, and it's just such a slick procedure. I just loved it. So when I went into private practice, I thought I'm going to be the erectile dysfunction queen. So I go into private practice in Panama City, and I'm there for 16 years, and I'm the only female in the entire Panhandle. So all of my patients are women.
Hell yeah, sister.
Yeah. So I was like, okay, I'm going to take care of what God brought me. So I started taking care of women, and I did basically all pelvic health for women, a lot of sexual dysfunction, low libido, incontinence, things like that. And then I retired for private practice and moved to Orlando and try to do a more holistic practice where I address the underlying problem and try and take advantage of some of these more natural ways of repairing the problems. And now I'm back to penises again. So it's just been a wild ride. It really has.
Wow.
It all comes back to dicks for you, doesn't
Yeah,
it?
it's like full
It
circle.
seems to.
But,
It seems to.
if you think about it, you kind of are a neurologist, because all of guys' brains are in their dicks.
Yes. Yes.
So you really are a neurologist.
I am the true brain surgeon.
That's fantastic. All right.
The man brain.
Yeah.
Speaking of, all right, Dr. Phillips, this one's for you. Same questions, actually. So what's your area of specialty? Where'd you go to school? And how long have you been practicing?
So I went to school at Nova Southeastern in South Florida, and I started off as family practice. I did that for a couple of years, and then went into urgent care, which I did for 15 plus years, had 100,000 patients go through my clinic. And as the patients kept coming in over the years, I kept seeing the medicine list grow longer and longer and longer, and people were on 12 to 15 medicines, and the docs were treating their symptoms and not curing anything, and it aggravated me. And instead of complaining about it, I went and did something about it and decided to get into the preventative medicine, which is what led me into functional medicine about 7 years ago. And that led into hormone replacement and back into the libido and erectile dysfunction. And so I started seeing a lot of that. And between hormones and having a healthy vitamin panel and a healthy gut to absorb your vitamins, those three things are the foundation of health. And I've practiced wellness medicine since that time.
I love that. That's amazing. So just to be clear, specifically dicks aren't your thing, but you're looking at the big picture.
I look at the whole human being, and the erection is part of your overall health. It's a clue of it, because it can be related to a lot of blood pressure things and cardiovascular disease, and also the mental game that we just talked about. But it's a complicated subject, but maybe there's a lot of easy answers out there for it, and hopefully we'll get to some of those today.
That's awesome. I love that it's overall wellness.
Yeah. Well, in urology, we consider erectile dysfunction the canary in the coal mine. It is the first early sign of cardiovascular disease.
No way.
Yeah, because the diameter of the arteries in the penis are half the size of the diameter of the arteries in the heart. So you will see a decline in erections far sooner than you're going to see hypertension or cardiovascular disease or heart attack.
Oh my God, I love learning.
Yeah.
That's fascinating.
I'm stunned.
It's that important to pay attention to. And yes, there are some things that are not related to it. But if you're having erectile problems, this is really why you need to talk to your doctor about them, because you're going to have some clues and some workup involved in it in many cases.
I like it. Well, so let's kind of stick with you on this one, Dr. Phillips. You treat a lot of things in your patients, but it seems one of the things that really gets men into the doctor's office is probably the first thing. And what I'm talking about here, Mallory says all the time that I won't go to the doctor if I lose an arm. But if I get a nick on my dick, I'm in the doctor in a heartbeat. Like, I'm there. So, like, problems in the bedroom get guys in the doctor's office. Problems with their dick get guys in the doctor's office. Whether it's problems with erections, reaching orgasm sensitivity, lack of desire, lack of interest, they all kind of point to some form of what we're calling erectile dysfunction. So how is erectile dysfunction really defined, and should it be better defined to kind of include some of these cases for improving sexual health as opposed to making people feel broken?
Well, I mean, it's a great question, but there are basic desires that human beings have, and it's food, water, shelter, and sex. I mean, that's just your innate, energy of life. And, when things aren't working in one of those departments, it's going to be one of those things you fix. And generally, when people come in here, it's low libido. It can be erectile dysfunction. We have questionnaires for this so that they're not uncomfortable. And also, fatigue and low energy, just not feeling well in life. And I have watched such a great success rate through hormone replacement therapy and other things that have changed people's lives. And, it's really important to see your doctor for these things, as we just discussed a moment ago. So yes, it does bring them in. And generally, some people are uncomfortable talking about it. Sometimes you have to goad them a little bit, but people are getting more open, I see, about talking about it.
Yeah, so it's not like we're going to walk up to a guy on the street and say, how's your dick today? I mean,
I might, but...
You might,
no,
yeah. Women are far better about talking to each other about things than you men are.
Yeah, we just don't do
We
that.
just don't.
We are much more comfortable
in everything in
socializing
life, for that matter,
Yes.
pretty much.
I like oversharing. It's
Right.
like my thing. So since we're touching on ED, Dr. Eisenbrown, how common is it, and what are some of the medical reasons for it?
Okay, well, it's far more common than people realize, and I think that's why people, men in particular, don't want to talk about it, because they don't hear any of their friends talking about it. In fact, quite the opposite. Everybody's always kind of bragging about how manly they are and how well they performed in the bedroom. But I'm a simple person, so I try to memorize sort of simple statistics. And when I read recently for an article I'm writing for a magazine, is it's about 10% per decade, and that's mild to moderate. The kind where, hey, it's just not what it used to be, or now I'm really starting to have trouble. So a man in his 50s, you can get about 50% of men in their 50s, it's not like it used to be. They're either having mild trouble or moderate trouble, 60% of 6-year-olds, et cetera. So, and I'd like to expand on a comment that Dr. Phillips just made about, the whole sexual activity is a basic human function. In fact, it's the most common unifying activity that we have as human beings outside of bodily functions. Mm-hmm. It crosses all races, all societies, all religions. I mean, not that many people exit the planet without having had sex.
Unless you've been in Congress. Then they just fuck us.
Yeah. Exactly. Don't bring that up right now, please. But, it shouldn't be something that's so hard to talk about. I mean, you walk in with a broken arm, they're going to say, hey, how'd you do that? Mm-hmm. Okay. Just because you can't see that you're that you're having trouble in the bedroom shouldn't be any more difficult to talk about, especially with your doctor.
Yeah, that's a good point.
We've heard it all before, so you shouldn't be uncomfortable. It's not like you're going to be the first person. I see people check in with colds and then come in and talk about their sexual stuff, right? Because they don't want it on their paperwork when they come to the clinic, or even if they get a STD or anything of that nature. So it's interesting how people are uncomfortable talking about it. We always hope that you open up to us, because it makes a difference in how we treat you. And you should be honest, because you're not going to be the first time we've ever heard anything that you say.
Sure. Well, so Dr. Eisenbrown had kind of alluded to some things that can lead to erectile dysfunction, like you said, cardiovascular issues, high blood pressure, congestive heart failure, and any of these things that reduce blood flow to your extremities. Right. Diabetes would be another one. Absolutely. I think that would come to mind.
Well, the two things that have to be functioning for you to be able to have intercourse are the nerves have to be intact and you have to have a good blood flow. So for the most part, cardiovascular erectile dysfunction is poor blood flow. About 85% of the time, that's it. But nerves can be a problem too. So for example, diabetics. Diabetes is an awful, awful, awful disorder, and it destroys the entire body, but it destroys your erections too. Someone who's had a spinal cord injury or they've had prostate cancer and their gland surgically removed, they have very limited options on how to fix that. Most of the other people, it's cardiovascular disease. We have lots of options of how to treat that.
Okay. Well, what about some other things, Dr. Phillips? So things like, are there mental blocks or anything that's really not physically medical that can lead to these type of problems?
Yeah, and one of the things we decided not to talk about was get too medical in this stuff, but I have to do a little bit here, but you have a sympathetic nervous part of your nervous system and a parasympathetic. And the parasympathetic, which is your relaxed part of you, is the thing that makes the erections occur. And the sympathetic, your fight or flight you may have heard of before, when that gets overstimulated, you don't have a balance there, and that will soften any erection that you have. And this is why the mild to moderate exists. And while we're not necessarily in treatments yet, this is where things that help stress or talking about problems may be part of the treatment for it. But there absolutely is a mental component to this.
Yeah, performance anxiety. Years ago, we thought this was all mental. We would just tell them it was in their head. Well, we now know it's mostly physical, but you can't eliminate the psychological part. The second you have performance anxiety, you pull the rug out from under yourself. So for some men, especially younger men, it really is that they've lost their confidence. And if I can just give them a couple or a few good experiences so they get their confidence back, then they're back in the game.
Perfectly said, because that's the fight or flight, or maybe we'll just call it fright.
Well, so before we started recording, we actually talked about this a little bit. We talked about how you can be too excited and too in the game. And if you're too in the game, the same thing happens. What's the reason for that?
Well, I would just, you're exciting the sympathetic nervous system. And, if especially in the lifestyle that you guys are in, I mean, you could have somebody that's new or comparing themselves to someone else. You let something get into your head and you stimulate the wrong system that you want to. And that's actually what will make the erection go down. So, yeah, I mean, it gets in your head. I mean, simply put.
Heads.
Yes.
Heads, both of them.
I knew that was coming.
I'm going to throw a curveball in here because it got me thinking. Is lack of desire, or if your desire or interest in sex starts to wane or goes away, even for someone maybe in the younger range, 30s to 40s, is that an identifier to go see your doctor?
Oh, absolutely.
Yeah.
Yeah. I mean, libido is testosterone is the primary hormone for libido in both men and women. We all recognize that in men, and we all talk about testosterone levels in men, but it's important in women too. So, when women go through menopause or, surgical menopause or anything, they lose their estrogen. Well, they also lose their testosterone, so all of a sudden they don't have an interest anymore. Their partner does. That causes discord in the bedroom. That kind of tumbleweeds on itself. So absolutely.
Yeah. And I think especially women don't take it seriously enough.
Oh, they definitely don't.
Because we are like, oh, we're just stressed, the kids, the laundry, work, and we don't use it as a leverage point to actually talk to our doctor, because maybe there's other underlying issues going on, like you said, low testosterone or.
Well, it's kind of a catch-22. If you don't have desire, you don't see it as a problem that needs to be fixed.
Ah.
I mean, if you don't want it, why do you see that as a problem I got to go fix the fact that I don't want it?
And that's unfortunate. Sorry to
interrupt.
That's unfortunate because it's one of the enjoyments of life. I have 85-year-olds on hormone replacement. And I will tell you this, because I treat men and women, I literally have an equal amount of men and women, because there's not a time where the partner isn't in within 3 weeks when they see what happens. And then they realize what they're missing out. So, and it doesn't have to be all men. And then the woman's like, oh my God, I can't keep up, or vice versa.
Yeah.
I try not even to do consults without both of them present in the room, because I know the other one's going to come in and then I have to do another hour and 15 minutes. So I just say, just come in. It's free. Might as well just do them both at once, because I maybe have 5 people in my whole practice who may be single or other reasons, but maybe that their partner is not getting treatment as well. And it's important in men and women, especially, men over 40, it starts going down, and women, it may start a little later, or surgical menopause. Then they don't have any testosterone at all. It's like literally zero. And just a little goes a long way for females.
Amen. I can testify.
Yeah. And to expand on what I was saying too, like I told you, I treated a lot of women for sexual dysfunction when I was in private practice. And the most common thing that they would say, they would come into me and they'd say, if it was up to me, and I never did it again, I'd be okay with that.
Oh,
but I
it's
love my
heartbreaking.
husband, and my husband wants to do it, so I want to enjoy it too. Can you help me?
So if I have to go to Disney, let's make it not suck.
Right.
I mean, some people love Disney World. Some people are like, screaming children, snot, germs.
That's mostly you.
That's mostly me.
Yeah, that's definitely mostly you.
I basically have to be on drugs to go to Disney.
Yes.
I'm in your camp right there.
Okay. I will drug you both. It'll be fine. All right. So we have been pretty fortunate to have doctors as guests on Casual Swinger quite a few times, and we always try to frame the conversation with them to help normalize talking to your doctor. We want the conversation to be, shameless, because you guys are the mechanics for the engine of our sex lives. If you don't know what's wrong, you can't fix it. So for each of you, does your approach to ED or sexual health discussion change at all if the patient is a swinger, and if they want to improve their performance in bed as opposed to having a problem that's initially bringing them into your office?
Well, mine always starts the same. I have a questionnaire and I have a workup, and I start very methodically through this because as a functional medicine doctor, I'm looking at the whole picture. So if somebody, it's not hard to diagnose erectile dysfunction. You know if it's working or it's not.
Sure.
And they come in, and in their questionnaire, which is usually hormone replacement, which is most of what I do these days, they're in here for that reason or low libido. I don't necessarily care in any way, shape, or form why someone comes to me. They're having a problem that's generally easy to fix, and I use a stepwise approach to it. It may start off with just simple things like, nitric oxide, which maybe we'll talk about in a few minutes, or just natural therapies. If that doesn't work, all the medicines. You've talked about these things before. And then we're going to talk about some other treatments a little later. I'll let Dr. Eisenbrown handle that. But does it matter if they're in the swinger population? No. And the performance is important because you want sex to be enjoyable. And if you're not getting a full erection, or it's not lasting during the sexual activity, then that's not going to be that much fun.
Or they maybe just want to go longer.
Yeah.
Yeah. I agree 100%. I mean, I've been a urologist for over 20 years, so I've heard it all, and I don't think there's anything somebody could say that would shock me. I have several.
Honey.
All right, well then maybe I'll have to put you to that challenge.
The challenge. You're setting the challenge there. That's
it doesn't matter as long as you're not doing something illegal or hurting somebody. Your lifestyle is yours, and I'm not there to judge. I'm just there to help you. And the lifestyle patients that I have in my practice right now are really fun people. I mean, maybe because you guys aren't intimidated by a lot of stuff, but I find that you're down to earth and you talk easily. You're not embarrassed to talk to.
No, nothing shocks swingers.
No.
We'll talk
and
about
that's really
anything.
refreshing for me because when you're talking to somebody that's uncomfortable, it makes you uncomfortable, and I do everything I can to make them comfortable. But if they're climbing out of their skin, it makes it harder for me. But
we own a sex toy store, so I get it all day long. I'm like, nothing shocks me, trust me. And then every once in a while somebody says something, I'm like,
never thought about that before.
So just as a follow-up to that, we talked, Dr. Phillips, you said initially that it's obvious if erectile dysfunction is present. It's obvious if the dick doesn't work, right? Because, you got a gummy worm hanging there and you can't do anything with it. But I think in women, lubricant has become so commonplace in bedrooms, and lubricant has become such a common thing for people to use that it masks the dysfunction in women, that it masks the lack of enjoyment in women because they just use lube and get on with their day and do what their husband wants them to do. And maybe even they still reach orgasm and they think they're enjoying it as much as they can. Do you think that there is a large percentage of women out there that are just getting by with lube and really not enjoying their body the way it was meant to be enjoyed?
Absolutely. Because with men, you have to be able to perform. We women can just lay there. I mean, literally, we can use some lubricant. Yeah. We can just be like, okay, are you done yet? I got dinner to cook or whatever.
Yeah. She's giving away her secrets now.
Yeah. But I mean, that's what happens is that so for women, they can still perform, so-called perform, but if they're not lubricating, okay, we can fix that with use some lubrication. We can use some vaginal estrogen, but if they don't want it, or if they're not getting pleasure from an orgasm, it's not the same experience for them, and that is going to translate into the relationship because the men are not going to be as excited, and you're not going to have sex as frequently.
Yeah. And listen, if a female's gone through menopause, they're going to stop estrogen production, and eventually they're going to get dry and need to use lube. So the age is relevant there. But going back to the basics of that, you can pretty much tell if that's going to happen to somebody based upon their labs. If they're not producing any estrogen, they're not going to be as lubricated during that. So yeah, it's very important for both partners to enjoy the sexual experience.
You know, speaking about normalizing things and normalizing the conversation with your doctor, which is what we wanted to do here, do you often find that people come in and talk to you and then you look at their labs and you can see that they're full of shit? Like they say, I don't have that problem. I'm wet every time. And then you look and you see they're not producing estrogen. You're like, you're a fucking liar. I mean, does that happen? I mean, I'm sure guys have ways they can lie too, but...
I mean, I don't know that that's an absolute, but I don't know that happens very often, I suppose. Maybe I'll get one of those shocked moments if that's the case. But, you know, it's pretty much like, you know, 5 years after not having any estrogen, you're going to have some changes in the vaginal area. You're going to get some atrophy. Quite often they'll talk about painful sex, or which is called dyspareunia. But listen, it's sort of an easy thing when it comes to hormones. You're missing it, we replace it. It's very easy to do. If your tank's on empty, you got to put the gas in it. And it's very easy. It's the same thing with vitamins. If you look and you're missing something, you replace it. It's not even really that tricky in the science. Now, it's a little sometimes harder to balance female hormones because everyone reacts different. We're all individuals. And so dosing isn't always the same. But at the end of the day, if it's missing, you're going to have not just the erectile stuff, but you're also going to lose a lot of health benefits along the way. And that's the reason ultimately, that's why I went into hormone replacement. You get all the benefits when you take it, but people feel certain things and see certain things with hormones. For me, I'm doing it to the protective benefits that they don't see or feel, so they don't get a stroke or a heart disease or all this other stuff. But it doesn't matter which reason you pick on that scale. If you're missing it, you got to replace it.
All right, that makes sense. And we're going to come back to that in another episode with you exclusively to talk about hormones. But in the meantime.
All right, so I think we're going to set aside ED for the moment, and let's talk about making sex better in general. So many folks, including you, Mickey, and myself, have experienced stronger orgasms as a result of using ED medication like Viagra. Are other drugs out there that are medically safe to use but increase sexual satisfaction?
The answer to that is yes. In particular, oxytocin, the pleasure hormone. I've had great success giving that stronger and longer orgasms. Yes, there's a few people that it doesn't work in, but the majority, it's been very successful as the pleasure hormone, and it's easy to take a sublingual and adds to the enjoyment and desire and libido of sexual activity for sure.
What is oxytocin and how does taking it work? I think we all understand how taking Viagra works. You take it, you get hard. How does oxytocin work and why does it improve sexual function?
You know, when you start to get on a pathophysiology level with all of this stuff, including like why does testosterone work? Well, they think it's a vasodilator. Not everything is well understood, but we do know that oxytocin excites the pleasure receptor in your brain. And that's the way that it works. So I won't get like microscopic with it, but it's literally exciting the pleasure center in your brain.
And it's safe to take.
It's safe to take. You know, you don't take everything every single day. We never recommend that. You know, the women's dose is a little different than the men's dose, but it absolutely works in most people.
What about the other drugs like Viagra, Cialis, sildenafil, or which is a generic Viagra, and then things like Trimix and Bimix? Are those safe for semi-recreational use as well? We'll ask that one of Dr. Eisenbrown.
I believe so. You know, as a urologist, when I was in private practice, the first thing we would use is all the oral medicines like Viagra, Levitra, Staxin, Cialis. There's a bunch of them out there now. If that didn't work, then we would move on to either Muse, which is a caplet that they put into the urethra, and that's a direct vasodilator. There's a pump that you can use with a constriction band that helps to just forcefully hold the penis erect so that they can have intercourse. And then there's Bimix and Trimix, which are injections into the penis. All of them have their pluses and minuses, and I would go whichever direction they wanted to based on which one they found the least evil. You know, nobody wants to put anything in the urethra, nobody wants to give themselves a shot in the penis, and nobody wants a ring at the base of the penis. But
did you say a needle in the penis?
Yes, sir, I did.
Okay, good thing I'm sitting down. Got it. Just wanted to make sure I understood that.
So, but now we also have other sort of non-medical treatments that help eliminate or reverse the cardiovascular disease, which is what I do now with PRP injections, which is the P shot, and Gainswave, both of which help improve erections, I think, much more naturally. And then the last thing we offer is the penile prosthesis, because that works 100% of the time, but it's a surgical procedure. And once you get on that path, that's the only path you can be on.
Got it.
You know, it brings up another important point of why you need to talk to your doctor, though, because some forms of treatment are going to be specific to you. If you have blood pressure or you had a cardiovascular incident and you're on nitrates and you start giving Viagra, then it's not going to work. And so there are contraindications to something. That's why you use other things. If you have nerve damage, as Dr. Eisenbrown mentioned before, you may lean more towards like a shot, like a trimix shot. So, a lot of people are going online and buying all these things. They don't know if it's going to interact with any of their medicines. They don't know if they have any health history underlying it. And so I do think it's important for your entire community that's listening to this now to know that they shouldn't really even be self-treating, if they're completely healthy, and maybe a 35-year-old without any underlying medical, maybe it's not going to do anything. I mean, I don't like to buy things online, but at the end of the day, don't ignore an erectile dysfunction problem if you have it, because there's a lot more to it, and you want to do something that's safe, whatever it is that's chosen for you.
Sure. Yeah. So I think television did a good job of normalizing the dysfunction conversation. Again, Ditka on TV for Levitra, things like that. People running through the, Sound of Music fields holding hands for Viagra ads and bullshit like that. But we've just mentioned a couple of really big leaps, in my opinion, in erectile dysfunction treatments. So and again, I don't like calling it dysfunction. I'd rather call it wellness, because to me, in my head, that's what these things are for. They're about improving your satisfaction with your life, whether it's with a consensually non-monogamous partner or with your monogamous partner, or your natural partner, however you want to refer to it. But more than pharmaceutical intervention, medical procedures are becoming kind of the norm. Which kind of scares the shit out of me, right? I mean, needles in your dick and rings around your dick and putting BBs in the end of your dick. And what wouldn't you do to have fun in bed, guys? This shit's about to get real. And it's going to get so real, they're going to do it to me here in a little while. So hang in there. But I read about a procedure called the P-Shot. And I heard about it from you, and you're an author. So before we're done here, I want you to tell everybody where to find your books and things like that. But P-Shot and the O-Shot, what in the hell are they, for starters? And if I get one, do I have an instant orgasm or something? I mean, what's the benefit of a P-Shot, and what's an O-Shot? What are they? Where'd they come from? How do they work? Let's hear it, Doc.
Okay. Well, both the P-Shot stands for priapus, which is the Greek word for penis. So it's the male version, and O-Shot is orgasm shot. So, but they're both basically the same thing. That's PRP, which is platelet-rich plasma therapy. And PRP is used a lot in many fields of medicine today. It's very, very commonly used in orthopedics and in dentistry, because bones, ligaments, and joints are very poor blood flow tissue, and blood flow is the key to healing. But the concept is you take a very high concentration of growth factors and inject it into a tissue, and it heals faster. So what we're going to do to you in a little bit is we're going to draw your blood. We're going to spin it out. So we'll get rid of the red cells, the white cells, proteins, things. Those things have very important functions in the body. But for healing, we want the platelets, because they carry 21 different growth factors. So we'll spin it out to a high concentration of platelets. And then, yes, we do inject it into the penis.
That sounds like a blast. I can't wait.
You'll love it, because you will be happy to know I give everybody a penile block. The inventor of the P-Shot, who's Dr. Runnels, does not give people a penile block. And for two reasons. Number one, he doesn't like the sensation of what his penis feels numb. He doesn't want to feel like it's not there. I get that, whatever. And he also takes pride in the fact that they can go and literally have intercourse right after the shot. I feel like I could wait an hour or two till the numbness goes away.
I'm good to wait.
Yeah. I'm good with you waiting as well.
Yeah. Well, you mentioned growth. Is that a side effect of this treatment?
Yeah, I need more information on that, and you'll see why here in a few minutes. Because when he said it could grow up to X%, I was like, that may be a problem for me.
Now, I will tell you, we don't promote it for growth, but it is sort of a side effect that some men find a good side effect.
Sure.
60% of men do experience meaningful increase in length and girth.
Oh, geez, Louise.
I'm sorry, honey.
It's okay. I'll just have to
maybe
stretch.
we'll give him a half a shot.
We might need to get you a donut to sit on for a while.
I did pick out a nice CC syringe for you. It's a giant one, so we were going to be nice to you.
What's the intended result of the P-Shot? Why do people do it? Like, why?
To improve erections.
Yeah.
Yeah, you inject the growth factor in there, and it tells the body, it activates the stem cells. The stem cells trigger, endothelial cells to create new capillaries, so you get new blood vessels which don't have any disease in them. It makes the old blood vessels healthier. So the net result is that you get better erections. And then I kind of
Raging wood.
yes. And I kind of didn't mention the O shot, and you asked about that. That's the female version of it. It does two things. It treats incontinence. So, as women have babies and vaginal deliveries and hysterectomies and just aging in general, the urethra gets a little bit hypermobile. So when you cough, laugh, sneeze, it kind of bounces. And so the door opens and the little urine squirts out. So, but if we inject some PRP right under the urethra, that stimulates collagen production and helps the incontinence. But in my opinion, the best part is we inject a little bit into the clitoris, and it really enhances orgasms.
Oh, I didn't know that, because I was just going to ask you if that was a G-spot treatment or if that was external.
It's sort of a G-spot and the clitoris. The G-spot, we don't know if it's really a region, but the most sensitive part of the vagina in a woman is right under the urethra. So that's where they say the G-spot is.
Okay.
So yes, it enhances both vaginal orgasms and clitoral orgasms.
Okay, well, our listeners are wondering right now, so I have to ask, if it makes men's dicks bigger, does she have clitzilla after she gets it? Is that,
yeah,
same
a
principles
little bit.
apply. Little thumb.
I can share that. Probably shouldn't, but from personal experience, yes.
Yeah. Okay.
It does make
That's
it
okay.
bigger.
It makes
Okay,
it's a bigger target. It's a bigger target. Some guys have a hard time finding it to begin with.
Yeah.
So it makes it a lot easier. So are the results?
Mallory's?
Yeah.
Yeah.
So are the results typically permanent, or are they just more therapeutic where you come back over time, or?
Both of them are based on Dr. Runnels' data. Lasts about a year to 18 months.
Oh, that's
you're injecting
long
your
time.
own blood into your body, so there's no like limits. You can get it as often as you want. I have men that will come in and get a P shot every 6 months because they just really love what it does for them. But you shouldn't. It's not like, your
like my
erections are going
Botox
to
or
completely
something.
go away.
Okay.
Right.
Yeah.
Right. Yeah. It lasts a lot longer than Botox.
There we go.
Are there any downsides to this? It sounds like it's magic, other than a needle in your dick. That's okay. But yeah, everything else sounds like magic.
Well, it's holistic way of treating a problem. So the downside is it's not free. It's
There's
time.
one.
Oh, sure.
Yeah, there's free. Well, of course, all the things that are free are really not worth anything.
I was going to say, you get what you pay for.
Exactly. The time and energy that you put into it. And, there's a mild discomfort, with the block. You're going to feel a little bit of the needle and the lidocaine. You can bruise a little bit, but very, very minimal.
How long has this procedure been around? I mean, the first time I heard about it was when I met you and Dr. Phillips. And I was mystified, and I thought I knew my way around this stuff pretty well. So this was something, and I think like Trimix, it was also, I had heard about it because of something that happened to a friend of mine that had a allergic reaction to Trimix that resulted in him having to have the prosthesis.
Right.
It was not good.
It was a long sordid.
It was a long sordid tale.
Yeah, that doesn't sound good.
Involved him
wasn't.
trying to use a half-hard dick and breaking it, but that's it happens. This has it been around a long time? Has it been tested? I mean, what's the history on this?
Well, PRP's been around for a long time, and there's over 12,000 peer-reviewed literature studies on PRP in general across all fields. The P shot and the O shot. The P shot was invented by Dr. Runnels, and I don't actually know how many years ago. I trained with him 2.5 years ago. I know I was aware of it for at least probably 3 to 5 years before that. So I would say probably in the last decade. It might have been around longer than that.
Wow. And so, and I'm going to jump ahead a little bit here, but with this procedure, you do another procedure called Gainswave.
Correct.
And Gainswave, I'm curious about what it is and what its point is and how effective it is as a treatment. I mean, it looks like shock therapy to the balls. Is what it looks like.
Well, then you're looking at it wrong because we don't treat the testicles. It's the penis. There would be no point in shocking the balls. But
I was going to say.
Other than pure comedic value.
Exactly.
If that works, let's just try it just for fun.
Yeah, I was actually going to say I'm looking forward to them like jumping in and out.
Why does everyone look forward to my agony?
I don't know. You are the same guy that had your balls waxed without a penile block too, by the way.
That's true.
That does not sound like fun, I got to tell you.
I had my asshole waxed on the air. That was a great episode.
Yeah, okay. Yep, that
People
doesn't sound
loved
like
it.
fun either.
No, it wasn't. So tell me about Gainswave. What is it? Where did it come from? What was the kind of the idea behind it?
Gainswave is low intensity shockwave therapy. As a urologist, we use shockwave therapy. We've been using it for like 30 years to break up kidney stones. But that's at a very high intensity because we're basically trying to break a rock.
Like lithotripsy?
Yeah.
Is that what it's called?
You had
Yeah.
it?
Okay.
You had it done?
No, but I was fascinated by
Okay,
it.
yeah, it works really, really well. But anyway, we don't want to hurt anything. So this is a very low intensity shock wave. So as the wave penetrates the tissue, it creates a low grade inflammatory response. Now, chronic inflammation is bad, but focused, purposeful inflammation is how your body heals itself. So we're basically telling the body to heal this. It activates the stem cells, which live right on the outside of the arteries. It softens the plaque that's in the arteries you have, so they become more elastic, so they can respond to the nitric oxide better, which is the on switch for erections. And then it creates neoangiogenesis. And I'm sorry, did I use that word? But basically that means new blood vessels. I didn't mean to get on Dr. Phillips' side of the stage there, but
yeah, right.
I'm going to learn how to say that.
He's the one that uses all the big words.
Yeah,
right?
but that combination of healthier old blood vessels and new blood vessels creates more robust blood flow into the penis in response to the on switch, which is nitric oxide, and you get a firmer erection. It closes the venous channels so that the blood can't escape, and you get a hard erection that lasts longer. It works very well.
Yeah. So in my head, if I had to imagine it, it's like a TENS unit, like when you have physical therapy. It's kind of like the same thing where you're telling.
Well, there's a vibration to it.
Okay.
Yeah.
Okay.
Okay, so you mentioned nitric oxide. Can you get the same thing by hitting a can of whipped cream at the grocery store?
I don't know, Dr. Phillips, can they?
I don't think so. I don't think that's going to do anything for you except mess up your brain maybe a little bit.
All right, so whippets and nitric oxide not the same.
Probably no.
Not a big fan. Kills a lot of brain cells, and that brain's important. So.
But it's interesting you mentioned that because like when a client comes to me, I like to address all the things that contribute to erections. And that's why the first thing I want to know is what their testosterone level is. And if it's low, I want them to go see Dr. Phillips and get their hormones balanced. But then we also want their nitric oxide levels to be normal. And we know that they decline with age naturally, 10% per decade. So, somebody that's 60 years old only has 40% of the natural levels that they had. The good news is it's just like if your vitamin D level is low, you take vitamin D. I just put everybody on a supplement. So I always try to enhance the on switch. And then I also block the off switch, which is the PDE5, which is what Viagra and Cialis block. Because I want to promote good blood flow to the penis 24 hours a day, not just at a party or Saturday night or whenever that occasion is going to be. The other thing we do too is the use it or lose it principle applies. Mm-hmm. Those of you out there who go to the gym know that someone who goes to the gym 5 days a week is in far better condition than somebody that goes once a month. Well, the same thing is true with your penis. When you were 20, your body exercised your penis while you were asleep. You got 8 to 10 good erections every night. And I'm sure you were more sexually active in your 20s than you end up being in your 40s, 50s, 60s, etc. So I put everybody on a pump, and I want them to get 2 good erections every day for 3 months.
Wow. Honey, that's a prescription.
Okay, I heard it. I
have
got
had
this.
to write that down before.
Yeah, gonna need you to write that into a prescription for me, Doc.
Yeah, but she didn't say I had to get you off. I just have to get you erect, so I can leave once you're hard.
Oh, that's bullshit.
Okay.
I know you. You won't leave one behind.
Yeah. Oh, that's a good line.
Now, so yes, no man left behind. But so when discussing this episode, when we really sat down to talk about it, for both of you, we came across a listener that's actually had the P shot to great effect. We ran into him at Hito.
Oh, okay.
And a huge fan. Like he
did wax poetic about it.
He did. And he followed me around and talked about his dick for 2 days.
It was adorable.
For you. But what struck me was his poetic romance with the procedure. He was so excited and so happy to have the conversation because I don't think he had ever met anybody else that even knew what it was. So I guess, I think the thing that really stood out to me was his quality of life improved. He was so excited about his life at that point. Not necessarily swinging, not necessarily just anything other than he was just excited to be alive and to be functioning the way that he or God intended, I guess. Reduced anxiety about sex, more enjoyment, optimism. Is that the point of everything you guys do here?
I think so.
It's the basis of what we just talked about before. It's your basic need. Once you satisfy, if you remember the id, the ego, and the super ego, the id is your basic desires, and your ego keeping them in check. But you're satisfying the most important things that really define us as humans.
But I think when there's any particular area of your life is really on fire, it spreads to other areas of your life. Okay, so and for men, being able to be strong in the bedroom is your sense of manhood. That's probably one of your core things that has to be strong. And that will spill over to you being more confident at work, et cetera. So absolutely. I think these things all cross-pollinate, so to speak.
Yeah. You guys can't see
I'm beating my chest.
Yeah,
just in case you couldn't see that, but
Captain Caveman over there. I love it.
It's super important.
Well, I'm not gonna lie. From my perspective, the stuff is kind of scary. We're talking about needles in the dick and needles in the vagina, which doesn't really sound awesome. So obviously, we'd love to normalize this. And how do we do that? How do we normalize these conversations with people?
Well, that's our challenge. When somebody is in a room with me, they'll talk about it. But out in public social situations, people get very uncomfortable. And I think doing this podcast, for example, and all the podcasts that you do help normalize it. When people hear other people talk about it and they hear other people's stories, they don't feel as alone.
And the fact that you're doing it. It's probably going to help normalize it a bit. So
that was the idea.
Yeah.
It's like, all right, I'm going to throw myself on the sword for these guys, and figuratively speaking,
so to speak. Yeah.
Your listeners are really going to appreciate it.
I don't know if they appreciate it or not, but they do think this shit is funny. I don't know why. My personal agony.
Yeah, I'm going to do my best at the color commentary, but we'll see how it goes.
Yeah, right.
Yeah.
So it should be at least modestly entertaining.
Yeah. So is there like an order of operations before they start talking to the doctor about, the P shot or the O shot? Is there something they should do first before jumping off that ledge?
Well, when I see them, I get a medical history on them, of course. I want to know if they're on medications that are going to interfere with their erections. Beta blockers are very, very well known to block erections. The antidepressants hinder orgasm, etc. Want to know whether they've had a prostatectomy or anything like that, so it's going to affect their nerves or diabetes, etc. But then I also give them a questionnaire that kind of puts them on a spectrum, so I know where they are compared to other men that would come in and maybe verbalize things a little bit different. And depending on where they are on that score, it helps guide me as to what is realistic for them. If someone has a relatively good score, they're going to do well with anything that they choose. And I give them their options. But I also have to be realistic for the person who, the hardest person I have to deal with is the man who cannot get hard enough to penetrate. Because there's a very hard line in the sand. You have to be able to penetrate to have meaningful sex. If you can penetrate, it's just not as hard as you want it to be. Anything I do is going to be gravy. You're going to notice it's going to be better. But if you're on the other side of that line, even if I get you 100% better, but you're not across that line, you still can't have sex. So it's I use that a lot in counseling men.
I like it. Now, what if it doesn't work? Is there another step? Is there something bigger than Gainswave? I was going to say electroshock to the balls, but apparently that's wrong. So, is there something bigger than Gainswave and P shot and O shot without surgical intervention? Oh, Siri thought that was not nice. But,
that's hysterical.
But is there something bigger and better? Where do you go if you tried Viagra, tried Libido, tried P-shot, tried Gainswave? You're still having problems.
If those treatments don't work, then you just have to continue down the path. Probably the next thing to try would be Trimix and Bimix, which work for most people. If we can't get a good erection with like a high dose of Trimix, then your only option is a penile prosthesis. And that's an option. And people who get that are very satisfied with it. Yeah.
And Trimix can make Jell-O hard.
I don't know if I can make Jell-O hard, but
this goes to your performance question before. But Trimix, it's not. It doesn't work by the stimulation part of it. You can ejaculate and still stay hard for as long as that medicine's in your body. It's bypassing that system that's causing the vasodilation and the erection. So this is one of those things where you might last an hour or two erect till. And then we'll talk about the point of no return, but it's not by stimulation. So even if you were to ejaculate, you can go a lot longer. And so that's probably the one that people might pick from a performance or worried about stage fright or anything else of that nature. But I think I'll leave it to the doc to talk about erection that lasts too long because it's.
Well, I was going to say that's probably the only really serious point that I would like to make in this discussion because I see people in the emergency room with priapism, which is an erection that won't go away, and that 4-hour limit is serious. So I tell my patients that if it's still rock hard after 2 hours, start heading towards the ER because after 6 hours, your penis starts to die.
Whoa.
Yeah.
Yeah.
But
And
just to put it out there is an antidote that you can take when you're done if it didn't go down. So you'll try it's basically Sudafed, and there is even a shot of that you can use.
Right.
So if you're getting to that point, you'll do that first, and that's going to generally work. It'd be very rare to get the priapism for that long, but like Dr. Eisenbrown said, there is a time limit.
Do not ignore it.
Yeah.
Do not ignore it.
Right. Now, one last thing, and this is totally unrelated to what we talked about today, but we see a lot of guys wearing cock rings to make their dicks look bigger.
Yes,
and they
especially
wear them
at the
all
resort.
day.
All
At the
day
resort,
long.
They wear them
And
around.
Yeah, I feel like that's a big no-no because it's constricting, right? And they do it so that they have a semi-hard or a full-on hard-on for the entire day. And I can see your face
Not
right now.
healthy.
It looks like a big no-no.
Well, I
I
had
can't
someone
say
argue
that's
with me.
probably good. Yeah.
I had a guy with a stainless steel cock ring on. I'm like, dude, you can take that off for a while, man. You've had it on for like 4 hours. And he's like, no, I wear them all day. It's fine. I'm like, no, it's not. It's not fine. And I was like, you know what? Your dick, dude. Do you?
Right.
But it's so for our listeners, wearing a cock ring around all day is a good idea or a bad idea?
I would say a bad idea.
Yeah.
I mean, you're the
I got two
likelihood
doctors
that
shaking their
you're
head right now.
Yeah.
the likelihood you're decreasing or cutting off oxygen supply to that tissue is not good.
And that's
Yeah.
where your brain is, fellas.
Yeah.
Don't cut off the blood supply.
Don't you love it's totally
Remember,
normal?
This is like the dick dies if you don't get the blood flow in and out. So
Yeah.
there's a certain amount of time that's
Yeah.
okay, and anything past that probably not healthy.
Yeah,
for the long term.
who knows
Yeah.
exactly how many long-term problems
Yeah.
they're having, but isn't it great that like you can look at another man's penis and be like, hey, yada yada yada, because that doesn't happen in the day-to-day world.
I care about
like out
your
here.
dick,
I
sir.
really do.
Really, this is all about
Swingers, we look at dicks
I
all
think
day.
that's great that you walked up to him and said that. And but now
Yeah.
tell him about the other treatments that will do some similar stuff. That
you. Yeah, that you're going to need after you kill your penis.
pretty much.
All right, so before we go, I guess we're going to go over and try one of these procedures on
so
yours
nervous.
truly, folks. So I'm a little nervous. Okay, so before we move on, why don't we give each of you an opportunity to promote your practices? Tell people how to find you if they have questions or they want to get in touch with you or they want to become a patient here in Central Florida. Dr. Eisenbrown, well, let's let people know how to find you.
Okay, well, for those of you who are driving, the easiest way would be FloridaGainswave.com. That's not hard to remember. Our office number is 407-212-9532. You can call that, or again, FloridaGainswave.com.
Yeah, like eyes are brown, but Eisenbrown. And we'll also put these links and information about their practices in the show notes. And we'll also put information in those notes for Dr. Phillips, whose information was not available at the time we recorded this podcast. We're going to move over and check this thing out. We're going to see how this procedure works. I may cry like a little girl, but before we do that, Mallory, why don't you let everybody know how to find us at Casual Swinger?
I will point and laugh. We are Casual Swinger everywhere. That's casualswinger.com. If you'd like to message us, it's podcast@casualswinger.com. Love us, please feel free to leave a review on iTunes. We are also on Twitter, Facebook, YouTube, and Instagram. Yeah, definitely Instagram. And all the swinger sites. Double Date Nation, Cassidy.com, Quiver, STC, and SLS.
Are you on Rumble and Parlor yet?
No, we
No.
kind of avoided those. Although Parlor apparently lets anything go, so we might jump on there before too long. But
Yeah.
nothing else to keep people from stealing our sexy cool name.
Yes.
All right, we'll be right back after this. You've been listening to Casual Swinger. All right, everybody, welcome back to Casual Swinger. My name is still Mickey. And the beautiful Mallory, the Mallory's here. She's hovering around a little bit for the moment. So Dr. Eisenbrown is going to start by sticking me with a needle. I'm really excited about this, Doc.
Drawing your blood.
want me
Where's
to-
your best vein?
My dick.
You don't want me to draw blood from your dick.
Okay.
I will if you want me
Probably
to,
here.
but-
Probably my left.
Right there. All right, let me take a look first before we get started.
All right.
I'm a doctor, not a nurse, okay?
Okay, so-
Just qualifying that right there.
You know, Doc, I trust you implicitly. My dick is in your hands. I mean, my arm
It will
presently.
be in a few minutes. Okay, squeeze your fist a couple times. Let me just see what we got. Yeah, nice one over there.
She's rubbing my arm right now, folks. So just when you wonder what she's saying, she's
All right.
she's
All right,
playing
just
with my
gonna give you a
arm.
minute while let me find some gloves.
It's okay. We can always blur it out. Do you need? Oh, you're going over there.
I'm
Here,
going too
I got you. Got you. So the cord on my microphone
me
is
just
not
pull
quite
these-
long enough
okay.
for the beautiful women in here with me, which is a problem I've had since high school.
You poor thing.
I know, right?
The crosses you have to bear.
Mickey and his tiny penis.
Aw.
Guys, she's going to see that shortly. You better be careful.
I've seen it already.
That's right, yeah.
I just should assume everyone's seen your penis.
Well, it's
Yeah.
a thing that I do. I just show it to people. It's a term of endearment, kind
You
of.
know, in our community, that is a welcome greeting.
It's kind of funny. Every once in a while, I'll be doing what I do, which is my life and whatever. And, you know, it seems all normal to me. And then I'll get a flash of, like, my father watching me. And I'm like, oh, this is not normal.
Well, normal in our business is definitely...
yeah. Well, so you can relate, you know.
Normal's boring.
Yeah, who wants to be, and who is
Do you need
normal?
a refill somewhere?
No, I'm good right now. I got a refill while it was in there.
Pump your fist again.
Pumping my fist.
So how much blood do you take submitted to the centrifuge for
60
therapy?
cc's.
Is that a lot in comparison to
Well, this is a 60 cc syringe, so I'm going to fill it.
So she has just penetrated me with her needle and is now filling this horse syringe.
It's gigantic.
With
It's
my
like
blood.
a liter of blood we're taking.
I could die right now, folks, and I'm doing this for you. This could be the end of Mickey right here.
Well, then it's going to be the Mallory show.
Yeah, right?
I get to talk? What?
Whatever, you do all the talking anyway, for anybody listens to. It's all right, so...
Impressive. It looks like it takes some skill there.
Yeah, it is definitely... She's one-handed pulling this syringe of my blood. So the idea of this, folks, is they're going to fill this syringe with my blood, and then they're going to separate the platelets from the blood, or from the plasma, rather, I guess, is the...
Well, the platelets will be in the plasma part.
Got it.
It's a double spin system, so the first spin gets rid of the heaviest things, which would be the white cells, red cells, proteins.
All the liquor I drink.
And then the next heaviest thing is the platelets, but that's what we want. So then we spin it a second time, so we get rid of a lot of the plasma and make it really concentrated.
Sweet.
It was like a physics lesson.
That's a lot of blood, Doc.
I promise you, you'll be fine. It's really only a few tablespoons.
Only a few tablespoons.
And everywhere.
She's
What is up with
finished. The vampire has finished relieving me of my blood. Yeah, damn, I'm bleeding all over the place.
that dripped out of the needle.
I know,
You're
I'm
fine.
playing. Hey, How to Make Your Doctor Panic by Mickey Casual Swinger.
Yes, let's not do that. I have had people pass out on me before.
Oh, really?
Well, you know, a very common fear is needles.
Like
And some people
needles
don't
in
like
your
the
dick.
sight of blood.
Oh, apparently I still have a spot of blood coming out of my arm, folks.
I got.
Right? She's got a thing.
I already had it open, so.
All right. Now
Gotta
she's going
use
to
it.
tear all the hair off my arm. Thanks.
No, you'll do that when you take it
Oh,
off.
excellent
And you'll
news.
think very fond thoughts of me.
All right, so it's
All right,
time for me to get the Gainswave treatment. This
Yeah,
treatment was designed to open up blood vessels in the penis,
This
right?
is the low intensity shockwave therapy.
Low
so it
intensity
creates
shockwave to the nuts, folks. I hope you're ready for
No,
this.
we didn't put any numbing cream on you. Do you want? But
Nah,
I think
I don't
you
need
did
it.
okay without it
Can I
last
say
time.
one thing?
All right, so we're going to pause for a second. We'll be right back just in time to hear me get shocked in the nuts. I'm going to let the Volkswagen out of the garage and be right back in a minute.
Oh, come on, you're no fun.
Yeah, right? So she asked me if I wanted the big needle or the little needle. That's what I'm going to ask every girl I hook up with from now on.
Yeah.
So what they're doing right now is a penile block, which is basically going to make me not be able to feel my dick until, what, next Tuesday?
No, about an hour or so.
About an hour.
Don't worry, the missus will feel it later.
I mean, if it's
All right.
all night, I'm fine.
There's
with
two
that.
ways that I do it. One is you can just go right in the center and then kind of that way and that way, or you can go here straight to the pubic,
Right above you, okay.
down towards the base. So I kind of just do each side. A little bee sting.
That was awesome. We should do that all the time.
So now we know you're a masochist because, oh my God.
Yeah, right? No, well, she's a sadist. She's sticking a needle in my junk.
I'm trying to make it
Just
so
know
you
it's
don't
right above your
hurt.
trunk. That's the good news. For
Oh,
now.
that's the great news. So the last time I got my asshole waxed, she's like, oh, I said you waxed my ass. She's like, no,
Which
we
hurt more, by
waxed
the
your
way?
asshole. Yeah, a lot more, actually.
This.
No, the asshole waxing hurt more. Like, tremendously. So I've got a gallon
'Cause
of my
they're-
blood spinning next to my head. I've got a doctor with a needle in my dick.
I see something.
So what she's going to do now is she's
Loving
going to
life.
shock my nads. That's going to be great. Can't wait.
Would be amazing.
And open up my veins.
Arteries.
Arteries. Which are different than veins somehow.
The arteries, the blood flow in. The veins
So the
way
blood
out.
flow out.
gonna say-
So
When the
we.
when the artery goes in, it fills up. That's what the erection is. And if you compress the veins, it won't come out.
Does
That's
it?
why you want to get it stuck there.
There's a little bullet in this chamber that goes back and forth, and as it hits this plate, it creates the acoustic wave.
That is
So there's 4 areas that we treat.
Hi guys, how we doing? I'm getting
because-
shocked in the nads.
Half of the penis is visible outside of the body, and half of it is buried under the skin. So we want to get the perineum part, which is down here.
And now I've got 4 people staring at my butthole. This is fun.
We're not
well,
staring at
that's
your
where this
butthole.
is going next. Just so you know, that's why I shaped that way.
Yeah. So that loud noise you're hearing is me getting zapped in the junk.
How does it feel?
Like I'm getting zapped in the junk.
Does it hurt though?
Nah, doesn't hurt. It's just a very unique sensation.
I've had people describe it as like holding a sparkler. You know, and when the little sparkles hit your skin.
A sparkler on your nuts might be a different experience.
Yeah. One person described it as being at a heavy metal rock concert and being able to feel the vibration but not the pain.
Yeah.
And then little rubber bands is the other way.
I was going to say, it's like little rubber bands smacking you repeatedly is
Right.
kind of the sensation.
Are you okay?
Well, yeah, I mean, I'm at the mercy of a room full of people. It's awesome. Yeah, it's definitely a unique sensation.
Yeah.
It's interesting, but it's not painful. It's like getting my asshole waxed, that was painful. This is more like, I don't know, it's perplexing, I think, is probably more than anything.
It's hard to digest after it was numb.
Yeah,
You know?
when it stays in one place for a while, it stings a little. And again, this treatment is designed to break up anything that's impeding the arteries flow, right?
Break up the plaque that you have, but also stimulate new blood vessel growth.
Well, I hope this is educational for all of you out there because my nuts are in her hands.
And
Literally.
notice we're not shocking the balls.
Not shocking the balls, just kind of swishing them around.
Right, kind of moving them out of the way.
Well, they'll move themselves out of the way out of terror. They're like, no!
That is probably exactly what they're doing.
Yeah, they're like, I'm not going to lie to you guys. It's a little weird having 4 people talk about my balls in the same room.
Sorry, I'm just super proud. Like that's
It's like you're not here. We're just talking.
Yeah,
like
it's
we're
okay.
watching a
I'm
video.
just going to sit over here and not be here. Just me, my balls, my dick, but not me. Well, and, you know, for those of you that are considering Gainswave out there, it really is not painful. It's just a unique sensation that you've never felt on your dick or balls before or around your, you know, any of that area. So,
Well, we also put a numbing cream on most of the time. We just didn't do that with you.
yeah, well, you know, I am a sadist. No, I'm a masochist. You're the sadist. That's
Exactly.
right. I wanted to know how it felt because I honestly can't tell the listeners what it really feels like if I'm numb. So, Dr. Eisenbrown, I have a question.
Yes, sure.
How long after the treatment should a person see or feel results?
With both the Gainswave and the P-shot, people tend to notice stuff the first week, especially the P-shot. But it takes 4 weeks to grow a blood vessel, you know, so those new blood vessels that we're talking about. So the bulk of the improvement.
Wow.
It takes 4 weeks to grow the first one. So, but, you know, so the body's going to keep doing that. So I tell people you get the bulk of your results in 4 to 12 week time frame.
I gotta tell you, the last time I had 2 women in a room with my penis out, it was very different.
Yeah. I hope so.
It was a much different experience.
Way to make it weird.
Like, it wasn't weird enough. Oh, great. We have now separated the platelet-rich plasma from the rest of my gallon of blood that Vlad the Impaler took from me. This kind of feels like medieval medicine, but...
Well, you know, things do go around, you know.
That's right.
You know, fashions come and go, and
That's true.
Soon we'll have Blue Jays pecking a wound again. All right. So I'm
All
just
right.
laying here. What's happening?
All right, well, I'm just waiting for this to stop doing what it's doing, which it is.
So when it's
All right, do you want to take a look at this?
Yeah, let's get a picture of that as well.
Okay, so this is the platelet-rich plasma.
Okay.
This is the old blood. So this is really concentrated, just red cells, white cells, etc.
It's super dark.
Now, if you've ever seen blood spin in a spinner, the top part's always yellow.
Yellow, yeah.
That's the plasma. The buffy coat is where the platelets are, and it's right between the plasma and the red blood cells.
Okay.
So we always, this machine is designed to take the very top layer of the red cells, so we get all of the buffy coat. So that's why it's still tinted pink, but you notice it's a much lighter color than the other one.
Yeah, definitely. Is there a reason the buffy coat's necessary or
The buffy coat's where the platelets are.
Okay, all right. I just learned something.
Oh, we're all learning things today at the expense of my penis. Although I shouldn't feel much because you put the block in, right?
I'm going to tell you honestly, some people feel nothing at all. Other people feel a little bit. It's very different, and that's why I think the anatomy of everybody's nerves are a little bit different.
Oh.
That's why I kind of tend to go overboard on the lidocaine, because I want to make you as numb as possible.
All right, so what they're doing
All right.
now is they're putting on some gloves, and then where I was formerly a man, I'll be a machine.
Correct.
Oh, your poor wife.
Every time I get a hard on, I'm going to go, no, 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 no. No, 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 no.
He's so romantic.
See, like, I wonder, like, how much of your crowd's gonna get that bionic dick joke right there that we just made. I think, like, 10 of them are like, what the hell are they talking about?
Anyone under 30 gets bonus points.
The $6 million penis. Before he was just a man. All right, now
Okay.
she's got my dick in her hand, so something's about to happen.
All right. You feel anything sharp?
Nope.
All right.
That we can
1,
donate
2,
to
3. How are you?
Well, my dick's in your hand, and apparently you're stabbing it, so...
But you didn't jump off the table.
No, I
so
didn't jump
that's
off the
good.
table.
So that block must be working pretty well.
Right? Either that or I have a numb penis.
So just for
Might be the same thing.
the sake
Might be the
of medical stuff,
All right. For science,
we're lucky.
Okay. And are you feeling anything as it goes in?
just a little bit of pressure.
Okay, good. Because it can, if you don't have appropriate, I don't know, anesthesia, it burns when it goes in.
Oh no, my dick is not aflame, thank you.
Good. I've had PRP injected into my face, and you can't mix it with lidocaine, so you have to do it without anything, and it hurts.
A lot of dentists.
This may be the longest my dick's ever been in a woman's hand non-sexually.
Yeah.
Well, I'll consider that an honor.
Good information.
There's probably a trophy in there for you. I did actually feel, I can feel that.
All right. You okay to go?
Do it.
Right now.
Doctor's like, do you feel that? Yes. Can we go anyway? Yeah, let's
Well,
do it.
it didn't feel like it was that sharp, so I was like, okay, do I need to give you some more lidocaine? Because I can.
Sensitive.
All
Yeah.
right. So now this is, we do put a CC in the glands.
And what
the-
glands are those? I don't remember.
What's the head of the penis?
Okay.
Okay. Now,
Not for nothing.
did that hurt?
Oh yeah.
Did? Okay.
Oh,
That's all right. We're good.
I'm
Can't
cringing.
feel it.
Now the glands is
I'm
not
being
part
honest,
of the
I'm-
erectile
Breathe
tissue.
through your mouth. I'm
So some
cringing
people
for you,
don't
just
do
so
the
you know.
glands,
Okay.
but Dr. Runnels does
Can you watch
recommend
it?
doing the glands to help improve sensitivity. And
Cool. I'm down with
sensitivity
that.
is of
Something
an
else?
important part
I will-
of the
I
experience.
will say as long
I felt that.
All right.
Nothing more.
See, your
than
penis is not
feeling.
dead.
All right, I still have a penis, and this procedure has been
there, still
completed,
there.
ladies and gentlemen. Oh, my dick's still in her hand, I think.
It is.
Oh, good. Good to know.
I'm just holding a little bit of pressure.
Okay.
Minimizes the chance of a bruise.
Oh, yeah, it's probably going to look like it went 5 rounds when it's over. Mickey, why does your dick look like Barney's dick? First of all, why do you know what Barney's dick looked like?
it looks normal
No,
to me.
no bruises.
No.
We're good.
All right, Mallory says my dick looks normal.
I'm very happy with that.
Awesome. We're done here.
All right. So, anything about that from that experience you want to share with your audience?
You know what? It was very clinical, very professional, very weird. But more importantly, as we come back over the next couple of weeks, we're going to share the results, like what changed. So that should be very interesting, and we'll come back and share more with Dr. Eisenbrown and Dr. Phillips. Ladies and gentlemen, we'll be back right after this.
And we're back, and you're still with us.
And I still have a penis.
I know.
Really
So,
excited.
just a quick recap. After those procedures, how are you feeling?
Really good, actually. I actually increased in sensitivity a little bit, which is kind of crazy.
That's very exciting.
Really had no clue that that was going to happen. I've been back to see Dr. Eisenbrown since we recorded what you guys just heard like 3 times for additional Gainswave treatments, which was not something I needed, but she wanted me to go through the whole experience for you guys. And it really is a good experience. I mean, every time I'm in there, they know me, right? So they ask about me and how I'm feeling and the issues that I have with sensitivity, which are my primary issues, and not something, in the theme of this episode that you would call dysfunction. It wasn't dysfunction. I just don't work as well as I could.
Yeah.
And so that's what they're concerned with. And I'm going through some things that maybe aren't going to have a huge impact, but the P shot did have a big impact. Now, something else that we talked about with the docs, and, this is a while ago, you may not remember this as well, but that there's a possibility when you get the P shot that your dick can get 20% bigger.
Yeah, her and I had it out about that. I was not prepared for that bit of information, and I don't feel like there's been a drastic or real significant increase in size with the one treatment. Maybe like the first week after you had it because you had more volume in there.
It looked like Sloth from Goonies.
It was a little lumpy. I mean, you had additional fluid in there.
Hey,
you know,
you guys.
But yeah, if it legitimately grows in length and girth 20%, I may be in trouble. I'll need frozen peas. Everyone listening out there, yeah, and an inflatable donut.
Yeah, it was a lot of fun to hang out with those doctors. But more importantly, I feel like they really shined a light on something that matters. And I hope that we got to do that for our listeners here, too. Yes, yeah. I got my balls shocked in the air. It was...
I don't stop calling it shocked. I mean, it's exactly what it sounds like.
Yeah. Well, they heard it. I mean...
Yeah. Sorry, guys.
But I think it's worth it. I think if you do have... maybe if you got to a point in your life where your erections aren't what they used to be and you'd like them to be, there's something out there for you. And if you would like the possibility of being larger, if you'd like the possibility of being more sensitive, if you'd like to have better, firmer, longer, more predictable erections, especially as a person in the lifestyle, there are things for you out there that go beyond, Levitra, Viagra, Cialis.
Yeah, and these treatments aren't going to be right for everyone, but it's nice to know that there's procedures out there that go above and beyond taking swinger insurance or the little blue pill or Blue Diamond Phillips or whatever you call them.
Well, make sure to reach out to our friends at Amore Medical. They're here just outside of Orlando, but they could give you at least some guidance on whether or not this is right for you, even if you don't live in the area. So check out the show notes or hit us up on any of our social media platforms. We can give you some of that information on Dr. Nicole Eisenbrown, and then we'll come back here in a couple of weeks and talk hormones and vitamins with Dr. Lane Phillips.
Yum. I'm excited.
You want to tell everybody how to find us? Let's get out of here on this long episode.
Yeah, we're Casual Swinger everywhere. Check us out at casualswinger.com. Reach out to us at podcast@casualswinger. We are everywhere. I mean, Twitter, Facebook, YouTube, and Instagram. And you can find us on the dating sites. That's Double Date Nation, SLS, SDC, Cassidy, and Quiver.
Yeah, that's right. Casual Swinger coming soon to a billboard near you. But hey, make sure to check out Casual Toys. You still have 2 weeks left till Valentine's Day. We have the bundles out there. We got the unique condom bundles. We got all kinds of good stuff out there. And use code BEMINE, BEMINE, for 15% off anything in the store. Ladies and gentlemen, we'll see you in a couple of weeks. Thanks for hanging out with us. You've been listening to Casual Swinger.